So I think we have good numbers here, so we can get started. But before we officially start, we at RESCON wanted to respectfully acknowledge that we are situated on the traditional territories and treaty lands, in particular those of the Mississaugas of the New Credit First Nation, as well as the Anishinaabe of the Williams Treaty First Nations, the Huron-Wendat, and the Métis First Nation. As the RESCON's offices are located in Vaughan, we are grateful to have the opportunity to work and live in this territory. I'll now turn it over to Andrew to deliver some opening remarks.
Thank you, Amina, and thank you for that. Just some quick opening remarks and then we'll get right at it. As always, health and safety is a team effort, and so we'd like to start by recognizing the work of the provincial government. We're going to hear some remarks from Minister McNaughton, and a mainstay on bringing this webinar forward, specifically ORBA, the OGCA, HCAT, OHBA, ORCA, and the Ontario Sewer and Water Main Association. I think we all work as a group collectively to try and make sure that construction as a whole hears the same things at the same time. Because if we can bring some consistency, as far as employer associations to the construction sector, I think it benefits everybody. So this is our 5th COVID event, and I'd like to say it's by far our most optimistic COVID event. And specifically, we're looking at vaccines and the good work that's been done there. So just as a stat, we are the leaders when it comes to the G20. And so over 76% of eligible people have their first shot. On Saturday in Toronto, we set a Guinness World Record. We had 26,771 vaccinations in one location on one day. We're not global leaders, and I guess the only reason for that is there's a couple, I'd like to say, smaller jurisdictions that, I mean, what they've done is unreal. So we're looking at it, Gibraltar somehow is at 115% of their population being vaccinated. So I'm not sure what that means or how they've done it, but I guess it needs to be applauded. But when you look at the sizable economies, the G20, and you look at the number of people that have gotten first vaccines, we've done really well. And I guess the nice thing is, unlike some other jurisdictions, we didn't plateau, anywhere from 55 to 65%. And so when you're looking at it, 76% plus of people getting the vaccine, if we can get 8 out of 10 people fully vaccinated, that really is going to be incredible, and it really will produce some, incredible results for us as an industry, but also Ontario and Canada as a country. So we're not out of the woods yet. And I guess that's why we're focused today on vaccines. And today's webinar is entitled Vaccine Rollout, Policy and Promotion in the Workplace. We do have some new information, but this will specifically build on our last webinar. And I think we're really trying to take a very practical, hands-on approach to give some real practical advice and deal with practical issues that are facing people in the industry. Specifically, as you know, we're going to hear from the minister and the CPO, as well as Mike Sherrod's going to provide a legal update. We're going to review some proactive tools that the industry has created. And we're also going to have a panel that's going to focus on the COVID sick days. How do we bring vaccines into the culture of safety? And then looking at, what has COVID done to the mental health of the industry and what are some resources that exist there. We're also going to try to do an interactive segment and ask the audience some questions. And the idea is we want some information from you guys as the industry so that we can potentially survey the construction industry in an anonymous way at a high level to try and figure out how many people are vaccinated and what we can do to really increase that number. And that's mainly because good decisions come from good data. And so that's what we're striving for. As always, wear your mask, even if it's hot out, and we'll talk about that today as well. But with that, I'm going to cue up the video and have Amina introduce the minister.
Thanks, Andrew. Our first speaker is Monty McNaughton, who is the Member of Provincial Parliament for Lambton, Kent, Middlesex, and Minister of Labour, Training and Skills Development. I can confidently say without a doubt that the minister has been a champion for the construction industry and the skilled trades. His government's leadership and support during this pandemic have been vital to our industry and to all Ontarians. Minister McNaughton is now serving his 3rd consecutive term in the provincial legislature. He got into politics at the young age of 20 when he was elected as a municipal councillor in Newbury. He served 2 terms and then went to serve as president of the Strathroy and District Chamber of Commerce. He was elected as MPP in 2011 and in June 2018 became Minister of Infrastructure. He was appointed as Minister of Labour in June 2019. In October of that year, his portfolio was expanded to include training and skills development. Minister McNaughton has shown his commitment to safety in construction and other industries and has hired another 100 inspectors to complement the 500 already in the field. Please join me in welcoming the Minister.
Of our journey throughout. Good afternoon, everyone. It's always a pleasure joining you to discuss keeping your workers safe. First, I want to thank you for everything you are doing as we reach the final chapter of our journey throughout COVID-19. To date, over 14 million vaccines have been given out in Ontario, and over 4 million people are now fully vaccinated. The tide is clearly turning. Hope is finally on the horizon. As we approach the end of our fight, we are sharing with workplaces tools to reopening in a safe, responsible way. Since March 2020, our ministry inspectors have conducted over 11,000 COVID-19 related inspections in the residential sector. Our government has always issued guidance materials for your industry to help employers understand what they need to do to keep your workers safe. We are doing everything possible to keep residential workers safe. I'm pleased that your webinar today is focused on these safety measures, including the need to encourage more workers to get vaccinated. If you encourage workers to take advantage of our government's paid sick days to get vaccinated, we will fully reimburse the costs of these to you. Your focus on enhanced PPE is both very important and timely, as well as the need to fight complacency in the workplace when it comes to following COVID-19 protocols. There is nothing more important than being safe, and RESCON has truly been a leader in the industry in promoting this message, so we thank you, RESCON, for everything that you've done. You were the first to develop safety guidelines for fighting this deadly virus. Early on, you moved to mandatory masks at residential projects. And today you continue to conduct thousands of rapid antigen tests every single week in the GTA hotspots to ensure a thorough screening process. You have gone above and beyond in keeping builders and others in the residential sector updated and informed on the current issues. You are not only working to improve safety within your own sector, but setting a great example by sharing your safety message with others in the construction industry. Thank you for helping us win this fight. We look forward to continuing to work with you and the IHSA to keep everyone safe. It's because of your hard work that construction was able to stay mostly open throughout, something that every family with a newly built roof over their heads is really thankful for. With everyone pulling together, Ontario is truly turning the corner. Together, we are keeping our workers safe, their families, and our communities as well. I wish everyone a great event today. Again, I want to thank RESCON for their partnership throughout a very difficult time and to wish everyone all the best. Stay safe.
And thanks to the Minister. I know we're here at RESCON, we've been very fortunate to have him as Labor, Training and Skills Development Minister during these challenging times. I'd now like to introduce our next speaker, Ron Koleski, who is the Chief Prevention Officer for the Ministry of Labor. The Chief Prevention Officer oversees the Prevention Office within the Ministry of Labor, Training and Skills Development and has a wide range of responsibilities that includes working with Ontario's health and safety system partners to prevent workplace injuries, illnesses, and fatalities, reporting to the Minister of Labor on the performance of Ontario's occupational health and safety system through an annual report, setting province-wide training and safety program standards, and the establishment and implementation of a provincial occupational health and safety strategy. Under the CPO's leadership, the Prevention Office has supported workplaces in Ontario to implement health and safety measures during the COVID-19 pandemic. This has included working on cross-government and industry committees and producing over 200 workplace guidance resources, which have been viewed over 1 million times. Please join me in welcoming Ron to speak.
Thank you, Amina and Andrew, and thank you, RESCON, reiterating what the minister said. Thanks for your leadership. This is, throughout this pandemic, probably the one most important thing was articulating really good, accurate, sound information in a clear way. I think that's helped us more than anything. And, Andrew, appreciate all the work that you did. Those 200 documents that Amina indicated now have been viewed about 1.45 million times. And the root cause of all of those documents was work that was done not only with yourself, but also the OGCA in partnership. So thank you for that. I don't want to go over some old stuff, but, as both Andrew and the minister said, we're sitting at now, as of today, 78% of the province has 1 vaccination and 37.5% have 2 vaccinations. And that's really good. And that's really positive. But I don't want to be too optimistic just quite yet, because we still are in a pandemic, and it's important to recognize that. Well, Peel Region and York and the GTHA are starting to go down quite substantially in their number of COVID cases. What we're finding is the dominant increase is in the Delta B variant, and it's places like Waterloo and Porcupine, North Bay areas that are starting to increase and actually surpass some of the GTA cities in terms of their exposures. And we also get some caution out of the states that the low uptake in some states, Missouri and Arkansas, Wyoming, North Dakota, and that type of thing, continues to put pressure on their healthcare system. And that is our Achilles tendon. I mean, if things get a little too busy in terms of the ICUs and CCUs, then that starts a whole area of concern. But notwithstanding that, I think it's important that, if information will be coming out for obvious reasons where people who are double vaccinated are probably going to be advised, it's okay to relax a bit. If you looked at there was a poster that came out from the CDC in Atlanta that showed 15 or 20 activities in the middle, and then on either side it had if you're vaccinated, if you're not vaccinated, and it provided people with guidance. We also, given our proximity to the US, we also see that, places like New York has just said, okay, you don't have to wear a mask. We've reached a point, we're comfortable, and so on. So, my feeling is on that right now that we really need to be clear that if the medical officer of health, say in the next couple of days, said, it's okay for double vaccinated people after their 14-day immunity period to be able to take their mask off. And if you're in the presence of others who feel comfortable and are double vaccinated, you can take your mask off if you're in a public space. But it's important that people understand the difference between a public place, a private place, and a place of business. The one thing we want to be sure of that while there is still the prospect of a Delta B variant that's highly contagious and highly transmittable, we don't know the science yet that you can be double vaccinated where you have less of a reaction if you're exposed to the variant than being unvaccinated. But we are still out on whether or not being vaccinated, you still can be a transmitter of the virus. So, what we don't want to see happen is people misconstrue that I'm double vaccinated. I don't have to wear a mask because the Chief Medical Officer of Health and federal government has said I can relax it. But what we don't want to have happen is that come into the workplace where you have people who, rightly so, continue to be concerned about the virus. We want to avoid unnecessarily work disruptions and work refusals because someone is fearful that they don't know if a person has been vaccinated and they're not wearing a mask. So maintaining the masking and protocols in the workplace are really important. The other thing that we want to avoid is that somebody believes that because they're double vaccinated that they can go grocery shopping and go into Longo's without a mask. Well, what we don't want is we don't want arguments in front of Longo's that says, hey, I'm in a public space. I want to go into the store. I've been double vaccinated. So, you know, I sometimes characterize it when we first started this journey where someone said, if you're within 2 meters, you must wear a mask. And people would say, well, I'm 2 meters and 2 centimeters apart from that person. I guess I don't have to wear a mask. And that did cause some confusion and some consternation, I guess, for workplaces because they wanted universal masking, regardless of how far apart you were. And I think that applies as we start to get out of COVID. And, you know, we do know that within the next couple of days that we'll be moving from phase 1 to phase 2, and that will create more freedoms and more opportunities for people. And, you know, our advice is that, you know, stay the course with respect to PPE. We will be updating some of our guidance materials to be able to reflect, you know, the needs of the workplace with respect to a new reality when things are opening up. For example, we worked with the Ontario Hotel, Motel, and Restaurant Association, a particular part of the economy that was hit considerably as a result of COVID. And we made a video for restaurants to really illustrate what was truly needed both outside with outdoor dining and also applicable for indoor dining as we move to phase 3, which will likely occur within the next couple of weeks at the current rate. And it was really illustrative. It ensured that the server had a mask and the server had a face shield. And I'm sure everybody on this call has probably been out in the enjoying their first patio experience. It was unfortunate we saw that there were a number of people that weren't wearing the face shield. And the reason we say that, it's multiple contacts, multiple people, frequently people that are talking. There are issues of continue to be aerosolization in certain circumstances. And we just want to make sure people are safe, because the last thing we need is to go into a fourth surge where we're closing things up again. And I think that's the concern of the government. With respect to vaccinations, we are working with groups of ministries to talk about the whole issue of vaccinations. And we know that, you know, do we make it mandatory? Can you make it mandatory? You know, what about passports? There's all kinds of things circling the news channels and the news medias on what you can do and what you can't do. And I think the closest long-term care community, where obviously there are vulnerable people, there is an expectation that the workers be vaccinated. And you must demonstrate either that you are vaccinated or you have a restriction that makes it unable for you to be vaccinated. And if in those two cases you can't produce either or, then you must be educated and you must sit down and take a program that provides information on what the vaccination is all about. And I just want to sort of center on that for a minute. The employers, and what we're recommending, employers have an obligation to inform their employees. This COVID pandemic has created more of a symbiotic relationship between the employer and the employee than ever before. The employers are now concerned about after hours. They're concerned about their family. They're concerned about community spread. They're concerned about ensuring that their workers have the right information at the right time to make the right decision. They're trying to keep their workplaces safe by ensuring active screening and sometimes enhanced screening through rapid screening. and antigen testing. So they've gone out of their way to do that. I think throughout, as we move into the third phase and the availability of vaccinations, is inform your employees, provide information to your employees on regarding the vaccination, because some people are speculative. Obviously, some people are scared. Some people are going to take a wait and see attitude. I know people that say, you know, I watched I Am Legend. I want to wait and see 6 months to see whether or not, you know, something untoward happens to people. You know, we need to reach herd immunity, and from a community point of view, that 75, 88 number vaccinated really makes a difference. But a workplace is not the community. A workplace is a confined area that have unique ventilation issues, that have unique confined space issues, have unique areas where people may not be able to physical distance. So we're saying continue to wear the masks, continue to screen, encourage your people to get vaccinations, provide them with information. If you know, without them having to ask, just make it available to them from a trusted source. You know, we are using science, but the science is evolving as we move forward. And it's important that we stay abreast of that science and also to stay abreast of what's happening in other countries with respect to, you know, whatever types of variants that there are. We do know that if you follow proper PPE procedures, you wash your hands, you follow good IPAC considerations, and you are vaccinated even once, but double vaccinated, that the significance of either contracting it is lower. And so we really are encouraging that. I do know that we have a number of meetings coming up on the vaccinations, and certainly the government will be providing guidance and information on that. But at this point in time, you know, we're not saying anything on whether it's mandatory or not as the Ministry of Labor, Training and Skills Development. We are simply saying encourage your people, and as the minister said, there are incentives. Those incentives are either time off to make it convenient for people to get those vaccinations, or to make available time through the sick pay program that was announced. So I think watch for the reopening for stage 2. The regulations will be posted shortly that will show some of the differences. I can tell you that for people that are on here that are training partners, it still remains 25 outdoor and 10 indoor with appropriate PPE and hierarchy of controls. When we go into phase 3, if all things being equal, phase 3 could be within 2 weeks, maybe at the earliest, 3 weeks, maybe at the latest. And at that point in time, things start to really relax when it comes to some of the restrictions. But we will provide updated guidance materials on as we are moving through into stage 3. We'll also provide that information if the medical officer of health happens to provide masking guidance in the public areas, much the same as the federal government has. And we will make that as clear as possible so that there's no ambiguity for employers. You're still required to ensure, do a risk assessment as things change. New sites, we still require the safety plans to be published and available on workplaces. Inspectors are going out. They're really concentrating a lot right now on those businesses that have not been open, or because of, you know, you talk about the hospitality industry, many of the people that are now working as servers are new to the industry because others have left during the period of shutdown, as well as those businesses that have been shut down for long periods of time, such as small retail. But they will not drop their vigilance on going into areas that we know traditionally continue to be problematic. They are taking a compliance assistance approach. We will educate before we before anybody issues an order. The idea is, to make sure people understand what they're supposed to do first. But if need be, we will ticket, and if need be, we will shut them down. So essentially, all the information you need is on the website, and the relationship that I have with construction, specifically with Andrew, if anything new comes out, I will send it directly to you. So that pretty much, a couple things, sorry. The WSIB has set up an expert panel, and the expert panel has been put together really to look at what have we learned from COVID? And I think we all will have that reassessment. Some interesting statistics from March to December 31st, 2020, there were 120 approved claims in construction for COVID. From January 1st to probably now, there's been over 680. So we know that the third wave was pretty substantive. We can follow the positivity rates in the rapid antigen screening pilots that we've been using. This expert panel is going to look at all kinds of things that what worked, not necessarily from a purely WSIB point of view, but how do you manage a pandemic? And we have some pretty exciting people on this panel. Steiny Brown, the modeler that came on every couple of weeks with Dr. Williams. We will be interested in experiences that business like construction has done. The logistics of rolling out probably 50 to 60 major construction sites in the GTA and almost 200,000 rapid screening tests taught us a lot. We don't want to lose that data. We don't want to lose the opportunity for that. So that's been put into place. The other thing that was announced in the budget, there's two things actually. We're going to build what's called an automated safety plan builder. And this will start out focusing on our COVID, which is the most immediate thing, or infectious prevention and control. But this will be a work in progress that will evolve to all risks. So if you're a garage and you're using brake fluid, you can type that brake fluid in and it will give you alternatives. You can look at risks from how many people can I safely fit in my store to what about my warehouse. So this is something we've been working with our digital lab, sort of our skunk works on, because this is something we learned out of COVID about making safety plan building easier for especially small business and those that don't necessarily have the intensity and exposure to safety as many of our construction people do. And then the other one is the government has announced over 3 years free health and safety rep training for businesses between under 20, essentially. They will fund up to $30 or up to 6 hours at $25 an hour and pay for the course. So we're going to be rolling that out in the next week or so to encourage our small businesses coming out of COVID, that it's just one added incentive to help them through their startup reopening, and to continue to provide safety without it being encumbered and burdensome. So essentially that's my 25 minutes of update. That's helpful.
Yeah, no, it was very helpful. If I can ask one question, just because we get it a lot, and I know that you understand the answer. I'm not sure everybody here today understands the difference between public health regulating the public and MLTSD regulating the workplaces. And I know you clarified it, but I have been known to beat a dead horse before. So
no, it's a good point. And one of the reasons that we came out with the guidance material way back when with construction was a conversation that had when initial public health guidance came out, and public health looks after the broader public health. OSHA looks after the workplace. So we're in a pandemic. You have an employer, and under the employer's general duty clause, they have an obligation to protect the worker from risks. So we require the employer to do a risk assessment. That risk assessment says, okay, there is COVID, there is a infectious disease that can bring harm to people. The Reopening Ontario Act requires me to have a safety plan. I have to build a safety plan. I have to understand the hierarchy of controls. So in that circumstance, under public health, you might be able to walk down the street without a mask, but the employer under OSHA would do everything reasonable to protect the employee, is going to require you to wear a mask. So again, a workplace is not the public. The workplace is a domain with other people, and those other people may come in close contact to people. They may come in close contact with the public. So that employer has to ensure the protection of the worker. And I'll use my favorite example, not because I frequent it a lot, but the liquor store. I mean, the liquor store is a good example where it regulated the number of people entering the store. It put lines on the floor to direct them in one direction. It made sure that there were physical barriers between the cashier, made available cycle times for hand washing, provided PPE in the fullest extent to the worker, and limited the number of people inside. So that is not public health, although public health will say, no more than 5 people in the backyard and you should be risked. It's sort of the same thing, but under OSHA, we can prescribe a few more things that may not be included in a public health order.
I really appreciate that. And on behalf of RESCON and the industry, I'm not sure if everybody knows, but Ron is going to be retiring, probably a little bit sooner than some of us would like, me included. But thank you for today. But I think, thank you for your incredible leadership. I don't know if it's been 16 or 17 months that COVID's been going on, but I certainly know you a lot better now than I did before this started. And I don't know if we'll ever fully appreciate the full value of everything that you did, but as far as construction's concerned, we've never had a better ambassador. And you've kind of set the new gold standard for a civil servant understanding how we work, as well as figuring out ways to work with us. If we're being honest, we're probably a high needs sector, and you certainly met our needs. And I don't know if our needs have ever been exceeded, but if anyone's done it, it's you. And so I don't know how else to say thank you, but I would like to recognize everything that you've done and wish you well. And if there's room for you to reconsider and stay on for a little bit longer, we've got phone lines into the minister. We can always see if we can get that retirement date pushed back for you. So, but I really thank you for everything that you've done.
Well, there's an old line from a movie, tempting, but no. You did thank me. Nothing need more to be said. It's been a pleasure working with the industry, and I would like to say collectively, in working with other sectors, whether it's manufacturing, healthcare, industrial, they have a home ministry. While infrastructure has influence over construction, we did adopt you, and I'd almost like to say the reason we adopted you is I have an old philosophy, never take for granted the butter on your bread. And I think that the minister clearly saw the need to keep construction open as an essential part of the economy throughout COVID, but even more importantly, getting us out of this pandemic. The infrastructure and construction is going to be the same. So the level of effort that was a collective, whether it be through, our partners at IHSA, the industry itself, the collaboration of the safety table, I think the industry is better for it. And where it once was an impossibility to get running water on a construction site, we miraculously, necessity became the mother of invention. So good on us. So it's not a one-man show. It was a collective effort.
Well, we really appreciate that. And thank you again. And I'm going to introduce Mike Sherrod now. And so I'm just going to pull him up onto the screen for everybody. So I guess talking about construction leaders, Mike has kind of filled the role that we've had for legal updates. And so if this is our 5th event, it's got to be close to Mike's 5th legal update for us. not exactly sure the exact number, but essentially Mike is the founding partner of Sherrod. I think he's well known in the industry. So instead of me talking, I'm going to let him take over.
Thank you, Andrew. Can everybody hear me okay? Volume's okay? Thank you. So I just want to build on what Andrew said with respect to Ron. My dad used to say, cool, calm, and collect. And Ron, during a time that was uncertain, when some people would say early on in COVID, people were losing their minds over the disarray that came with it early on, you provided calm, considered, and reasonable leadership, and you continue to do so. So kudos to you. We all benefited from your leadership in this. So I'd echo Andrew's comment about, think about sticking around. We wish. So on to some of the legal issues, and really Ron's covered a lot of the landscape, and I'm going to try to go over some of the areas and just food for thought more than anything else by way of an update. I'm going to try to talk briefly about one of the biggest conversations that appear to be going on, not just in construction, but all over Ontario and other jurisdictions in the workplace, that being whether or not an employer can implement a mandatory vaccination policy. Is that a good idea or not? So I'll make some comments on that and try to provide a little bit of guidance for your consideration. Whether you have a mandatory policy or not, can you require people to disclose their vaccination status? And that seems to be the next area that has many complications to it. It's not the most straightforward answer. I'll try to talk to that. General contractors and subtrades, as we all exist on common sites, what should GCs be requiring of a subtrade, and or can they, as it relates to a subtrade's employees? I'll make some quick comments there. Best practices outside of construction, what are we seeing elsewhere in the different sectors throughout the province? Any contextual differences when I'm looking at a group that are working on site versus working in an office setting, and what are the differences as it relates to our go forward as everybody is returning to work? I'm glad Andrew picked up the difference that we should be very cognizant of between public health and the Ministry of Labor, Training, Skills and Development in terms of that, I'll call it that different lens they come at, because I know a number of us have been struck by some of the differences when we get directions or advice from public health versus what we might get by way of direction from the ministry itself. And then we'll try to leave, Andrew, I said I promise I'd take some questions along the way if I could, and or leave a little bit of time at the end. So let's jump into the very first point, mandatory versus general. Lots of employers, I think, would love to hear that they can make that policy mandatory. I don't think it's going to be that straightforward. I want to give you two quick examples. Morgan Stanley this week put out a notice to their employees in New York and Westchester, I believe it was, and they said they will now ban employees and clients from attending at the workplace unless they have double vaccination and proof thereof. I'd suggest to you that that's pretty aggressive, but that's the first of what I suggest will be many employers who are going to try to push the envelope on mandatory vaccination policies in light of the risks. The advice you're not going to get on this call is that that's going to be airtight and a lawful response, but you're going to see many employers start to look hard at that. But I think the real, if you want a policy, and I think the best I've heard over the last sort of 10 days, think a little bit about what you can enforce, because all of us have seen laws come in place that are very challenging to enforce and they don't do us a lot of good. So our advice is, instead of thinking of a mandatory policy, think of a general policy, and think of, as Ron mentioned it, think of the non-punitive alternatives to a mandatory policy. And Ron mentioned some of these. So a general policy that says, we encourage you, we want to influence you, we want to advocate that you go and get your vaccination. We will incentivize you to go and get the vaccination. And I think people have now gone beyond the ideas that Ron mentioned this morning, the idea that you give an employee paid time off to get their vaccination, or you look to the sick leave program. We're now seeing people actually pay people an incentive. I've seen everything now from a gift card. I walked into a gym the other day, and the gym's advertisement, not in Ontario, by the way, the gym's advertisement actually said, go get a vaccine and you can have a month free membership. So it's getting very creative, and I think it behooves employers to think about whether they're unionized or not. If you're unionized, work with your union partner in terms of coming up with something that will be hopefully supported by both. The major difference, obviously, between mandatory vaccination policy versus mandatory testing. Remember, testing, obviously, we're taking a specimen away from the body as opposed to putting something in the body. That seems to be the largest difference. And we don't have, some people will argue we don't have sufficient scientific data yet to get to mandatory. Ron's comment is telling. And for me, what I say when I heard Ron speak this morning, stay tuned, because thus far, both the federal and provincial government have not given guidance that suggests there should be mandatory vaccinations. The one slice, and I heard that earlier as well, was long-term care facilities. Because of the guidance in that versus no guidance toward mandatory vaccination policies, I think right now we're looking at general policies, inside the policies, making sure that you're educating and advocating, providing for accommodation where somebody says, it's not just a personal choice. I have a human rights-based reason for not wanting to get vaccinated, making sure that that's there, making sure that you individualize that assessment as well. And then do you in the policy also have an ability to accommodate someone who is not going to get the vaccination? That duty to accommodate, remember, comes out of our Human Rights Code, at least in the Ontario province. And we look at Section 5 with respect to the various things that we might have to accommodate. The ones that seem to come up most on vaccinations have been medically related disabilities or other medical reasons. And there have been some people who have raised religious basis for their inability to get a vaccine. So I guess I've done this a bit backwards, because what I should have said at the front end is it really behooves employers to put a policy in place. Let's make sure that there are clear expectations written down on paper so that you have a shot at consistency, and then individualize when you look at the individual person in terms of how the policy applies. But let's get a policy on paper. And if you're unionized, remember that there's case law that gives you the methodology to follow to ensure that you have a best shot at the policy being permissible. And that some people will refer you, if you're talking to your own employment counsel, they'll refer you to a case called KVP. And KVP has 5 or 6 principles that you want to work through to ensure you do your best at making sure that policy is enforceable. Let's move on now to disclosure. Some people are arguing that the vaccination status is personal health information. So we want to first start there, thinking that if I'm going to ask people whether they've been vaccinated or not, let's assume or think of or consider at least that information may be considered categorized as personal health information. Each of you probably have a privacy policy. If you don't, it's time to take a look at that. In the privacy policy, there are a number of principles. Whether you're in Ontario or elsewhere, the principles are pretty much the same. The first one is, let me back up and give you a balance to think about. What does the employer need to know? And what's the least intrusive means to achieve that objective? Does an employer need to know whether somebody's been vaccinated or not? And some people say that's still an argument. I'm going to move forward as if the conclusion is we do need to know. And remember, there will be people that will challenge that because of the nature of that information. But let's assume you've decided, I want to know the vaccination information. Then you want to think about, again, the balance, what you need to know versus the least intrusive means of achieving that. And so many people are thinking of, for example, please inform the employees what you are asking for and why you're asking for the information and what you intend to do with it. So we call that informed consent. Very important principle if you're going to try to collect this information. Next, can you narrow the audience who will receive and care for that information? In other words, do all my site supers get it? Not necessarily the way to go about it. Could we do it if you happen to have a human resource professional on your team? Could the human resource professional be the one that collects the data and it's limited to that person? Is that possible? So one possible idea to narrow who has access to the information. The next is, how are you going to take care of it? And what is it you're going to take care of? Are you going to require people to send you that information through an electronic email with the proof of vaccination attached to it? Do we really need that? Or here's a lesser intrusive means of potentially achieving this. Could you have that person simply act as somebody who is showing proof of vaccination to that HR professional, and that HR professional just checks off the person's name, never actually keeps or receives the actual copy of the vaccination? So again, food for thought. It won't be perfect, but that's one thing to think about if you're going to try to do the least intrusive means. Next up, make sure people know who's going to care for that information and how it will be secured. And then finally, ultimately, what's your destruction policy? And I've just given you 4 or 5 of the principles that will be in a typical privacy policy. And remember, you'll also have some legislative oversight depending upon what province you're in. So watch for that. General contractors and subtrades. I think the one thing I'd comment on, and Andrew, you mentioned it briefly, I want to emphasize it again. As we move into the summer, and Ron said it too, it's not a time to let our guards down, right? It's not yet time. If we want to continue to keep this construction industry open, I think we really have to be vigilant. And as the temperatures heat up, it's going to be challenging, but it behooves every leader on the phone with us today to think about, how can I continue to keep people being compliant with all the health and safety precautions that Ron's always given us great guidance on, and the ministry's got our guidance, right? And nobody's saying let our guard down yet. And certainly with the information we have around the Delta and the Delta B mutated virus, we still need to be awfully careful because science is catching up, I think. But all of the guidance from distancing and hand washing and masking, eyewear protection, all those good guidances that we've been living with, we need to continue to find a way to motivate our people on site to continue to participate in those health and safety means. I don't think the time is yet to say we're free of this pandemic. I think most people from a scientific perspective would say we've still got a ways to go. If you were looking at a mandatory vaccination policy, just to go back to where I started, somebody's going to ask you, was there a lesser intrusive way to protect your people? And some people will say, well, for example, did you participate and or use rapid testing? Because maybe that's a way of still accomplishing your objective, keeping everybody safe, but not actually the intrusiveness of a mandatory vaccination policy. So food for thought in terms of what were the other efforts you made to keep people safe at the workplace. If we go into the jurisdictional scans and best practices, you heard Ron's comment about those industries, not so much like construction, that are now trying to get back to work for the first time. They're learning lessons, frankly, from you and what enabled you to stay open through this whole period of time. So what we are seeing, I use Morgan Stanley. I think the other example to get closer to home is Royal Bank. And Royal Bank has said they're looking at requiring people, they're either going to do the following. They're going to cohort people. In other words, in their setting, they're going to have, at least they're talking about it, one spot where people who are vaccinated will work and another spot where people who are not vaccinated will work. That's going to be pretty challenging, I'd suggest, from a practical perspective. But what they are saying is in their policy, there are some exceptions. Can you still work from home? May not work for a construction site, obviously, unless we're talking about potentially head office and the office workers. What other alternatives are there to cohorting like they're talking about? The one element that I think is a key right now is, unless you're in a very specific sector, and I don't think that's going to apply to construction without some government direction that we don't have yet, I don't think we're going to be successfully able, and I don't think anybody's contemplating it, but somebody refuses a vaccine, can I terminate them now for cause? I think the legal expertise or the legal thought on this right now is it's not likely cause unless something changes with government direction indicating that there might be a mandatory vaccination approach. On-site versus office, I think you heard Ron say this. This is all going to be quite contextual. So while we recommend you have a policy, make sure in the policy that we have a contextual analysis as to what your requirements are. Andrew, I think I'm going to stop there, subject to questions, and hopefully that's provided a bit of an update.
No, that was fantastic. And I'm going to turn it over to Amina, who I think has collected a couple questions.
Sure. So the first one is, do employees have the right to refuse to answer the question of whether or not they have been vaccinated? And are employers, are they allowed to ask that question in the first place?
Yeah, I think there's no clear black and white answer as a starting point. I think there is a school of thought that information is personal health information. And unless you, the employer, can prove that there's a bona fide occupational requirement for your knowledge of that information, there will be some pushback in terms of rights. And anybody else wants to weigh in on this? Because we've been advocates of saying, because how do you decide whether somebody maintains all the PPE protections? And maybe that's one of the more practical answers to start with. If you're not going to provide me with that information, or without that information, we still require all the different PPE and distancing. I think maybe that's the inverse, the better way to get at this right now, as opposed to trying to figure out who's got the right to know that. It's without any of that information, we need to continue this process. And some people would say, remember Ron's comment, I think, Ron, you remind us, I think one of your comments was this morning, even with the double vax, we don't have real clear direction yet in our province, in our workplaces, that there's a whole bunch of things that we can now remove from our typical health and safety protocols.
Right. Yeah. I mean, the science hasn't said that if you're double vaccinated, you cannot transmit the virus. So it's, I guess I'm no lawyer, but unless you have that correlation, it's pretty hard to create that you have to tell me environment. However, what they found in healthcare, as an example, in long-term care, that because they're dealing with vulnerable populations, they could ask the question, because there was that, well, it's actually enshrined, but they can ask the question. But it's those other areas that are difficult. And, what we found in some jurisdictions, it's like prom night in New York, where the school said, if you're double vaccinated, you're welcome. You don't need to wear a mask. If you're not vaccinated, you have to wear a mask. So, or you can get the concert ticket for $29 if you're vaccinated, and $99 if you can't show proof of vaccination. So, but it's not here yet.
And the only thing I would say is, let's assume you say, thank you for the advice, but I'm going to ask anyways. Now start to think about privacy compliance means of protecting that information you collect, because you won't be the first person who has listened to people saying you ought not to ask that, and they decide they're going to anyways. If you're in that situation, now it's a risk mitigation. How are you going to collect it in the least intrusive means, and how are you going to protect it? So just food for thought.
And then there's another question in the chat. Will we be able to uphold continued PPE distancing if you don't have the vaccine or are not willing to disclose it to your employer? Nurses used to have this with the flu shot, and it was eventually refuted in Ontario. Will this precedence prevail?
It's a great question. And my quick 2 cents is, I think in the interim, in other words, right now, I think you'll still be able to require the PPE and distancing. I don't think we have any guidance yet that will be solid footing right now that says as an employee, you have the right to no longer wear the PPE that's required, that has been the guidance that's been required so far.
I think that was it from the questions, unless Andrew or anyone sent some to you.
I just got one. And so the last question was, obviously this isn't the first vaccine that's ever been created in the world. Is there anything we can learn, I guess, from previous vaccines? And I guess the question was kind of focused on mandatory versus voluntary. And I guess I'll add my own bit in here. Looking at the schools, kids have to be vaccinated to go to school unless there's a religious exemption. I guess as a broad question, what do we know based on past vaccines, and how does that help us figuring out COVID vaccines?
It's a great question. There are comparisons. I think I listened to Dr. Schwartz last night talk about the government. I'll say government large for a moment, getting ready to put out guidance, especially on schools and children. I think that's coming in the next 3 to 4 weeks, I think is what I heard in terms of the intention. I think on the comparing it to other previous mandated vaccinations, I think for the most part, they were government driven as opposed to an individual employer trying to make that decision. And so I think we're in a state now where we continue to pay attention to Ron's ministry, public health. I don't think we're going to be able to see the comparison successfully without the government making that linkage and giving us some direction.
Yeah, and this is our first, pandemic. When we think of smallpox, diphtheria, polio, there were clear. It was a different time too. I mean, I like to say, if you really want to find out being the ham and the sandwich, just Google my name and put flu shot behind it, because in 2000, the government mandated that healthcare workers had to have the flu shot, the good old flu shot. And that included paramedics. And when I ran the paramedic service in Toronto, it was either shut it down because people were adamantly refusing to get the flu shot. Now, ironically, 20 years later, those same paramedics were the first in line saying, where the hell's my flu shot? But I just lived through a point in time in history where people sometimes, just for the sake of arguing they don't want it, that's a personality and a behavior that we have to deal with that's challenging. But, eventually you come to the point where you say that either where it may come down to, you either have to wear a mask if you're not vaccinated, or in some cases in healthcare, they've just assigned you to a your job today is to polish the 50-yard line of BMO Field, and nobody's in the stands. And that's where you're going.
Yeah, go ahead. I mean, I think there's maybe one more.
Yeah, it's not so much of a question, more of a comment. In a crew of 4 and 3 are vaccinated and 1 refuses, it seems like we're more worried about the individual who refuses as opposed to the rights of the 3 that are vaccinated. Again, just a comment, not so much of a question.
I think there's a balance to be struck. And I suspect that all employers will still require certain things of that 4th person, including like Ron's comment. If we start to get guidance of the necessity to do something to protect the 3, because we start with, right, the employer's duty under the Occupational Health and Safety Act, or simply the duty of care. Either one of those say, I have an obligation to keep people safe. So that 4th one that's not vaccinated still has a number of health and safety protocols. And for example, maybe, Ron, we can kick this one back and forth. Is the mask for the purposes of keeping the wearer safe, or those around that person?
If you have a medical grade mask, that's there. It serves 2 purposes. One is to protect you. It's like probably the best example that had back in March of 2020, the guy, if you don't wear your pants and you pee, you can pee on the other person. If you wear your pants, you're going to pee in yourself. You're not going to pee on the other person. So really, it's designed to protect both you from others, and predominantly you, because if it's airborne or droplet spread, full PPE is going to keep it confined to you and not to your neighbor. So, you know, I think this scenario gives the employer some real good openings because, you know, by virtue of the person saying, I'm refusing to tell you I'm vaccinated when 3 others are telling you to vaccinate, then the employer has the right to say, well, you're going to go over there and the 3 guys go to the work site in the truck, or, you know, you got to wear all the gear when you're in the truck. All 4 of you have to wear all the gear when you're in the truck. And then when they get to the work site, maybe you'll see how they figure it all out between them, you know.
Goes right back to, I think, to enforcement, right? And it's cool, calm, collect, considered the rationale, because in the way Ron took this example, it was a personal choice as opposed to somebody pointing at a human rights-based rationale. And so I think employers are going to have to deal with this, because you can see 3 people saying, we're going to exercise our right to refuse to work. And then you work through that work refusal piece that I think ultimately ends up where Ron just said to us, right? That individual is going to be, you know, maybe on a leave of absence. I'm not sure you get to just cause in that threshold, but we certainly will be taking care of people first and foremost in those work sites.
And I think just to jump in and wrap it up here, this is why in the panel we have Dean Dunn from IHSA talking about building vaccination into your culture of safety, because really this gets into how do we actually get this done on site. And maybe I'm naive, but I think at the end of the day, if we go to that crew of 4 people and say, okay, we can all wear PPE, or everybody can get vaccinated, and you start to outline the steps of what, you know, working on a site where everybody is vaccinated versus working on a site where people aren't disclosing or aren't fully vaccinated. And all of a sudden, you know, I think you'll get a very practical solution, I would assume, in most cases. So with that said, I think we will deal with this issue again a little bit later on. I do want to take the opportunity to thank Mike. I think not only do you give great legal advice, but you take it to the practical level, which is helpful. Because as you know, and as you said, it's one thing to have the legal right to do something. It's another thing to implement and act on that legal right. And so, you know, I think you had lots of good advice today, but I think when you said focus on how you can implement it, I think that made a lot of sense to me, and that was very practical. And so we really appreciate that mindset as we go through this stuff. So thank you very much.
Thank you.
Okay, so moving on, we're going to introduce Ahed, and she works with RESCON. She's a little bit newer, but she's played a very crucial role at RESCON. She's really been our go-to person when it comes to COVID, especially when we're looking at the government updates. And so she certainly knows a lot more about COVID than I do. And I definitely have used her as my crutch over the last, I guess, probably year. I don't know if she's actually been here that long, but she is a very valuable resource. And so she's going to walk you through an industry resource that we created. And I'm not going to steal all her thunder, but I am going to say the reason why we created this was kind of touched on already. So Ontario has 3 levels of government, and it has lots of groups that work in the health and safety space. And so as vaccines started to roll out, it was really confusing because each level of government and all the different agencies had a different part to play. And so the first goal, and the reason why we created this vaccine cheat sheet, was to address that. And so, you know, with that, I'm going to turn it over to Ahed.
Hi, everyone. So today I'll be sharing with you the RESCON vaccination cheat sheet that we have uploaded on the RESCON website. I'll just take you there now. Sorry. Okay. So when you get to the RESCON website, when you go to the COVID section, under vaccinations, we'll have the guidance sheet right here. Okay, so I'll talk to you about the reasons why we created this sheet, how it works. I'll take you through a few demonstrations and some feedback that we've received. So why we created this is because information has been coming from so many different entities, all different levels of government were involved. The information was changing constantly, and we noticed that a lot of people were having issues registering for their vaccine. They didn't know when they were eligible and they didn't know how to. So given that information was changing more than 2 times a week, we decided to just bring all of the stuff in one spot to make it easier for people to have direct links to register and book their appointment. And especially with requirements changing from different levels of government with the province, for example, if an age requirement was 12 plus, with different municipalities, it was different, like they would have maybe 18 or 25. So yeah, we put it all here so we could streamline the process for everybody, and we updated it almost every week or whenever information was made available. And we also simplified it every time. So at the beginning, we had things like all the pop-ups and all the hotspots, but now that there aren't as many hotspots, we lessen the amount. So yeah, I'll show you how it's divided. We divided it by region. It covers most of the GTA. We have the list of postal codes, especially when it came to pop-ups. We have the locations, so where you could get it, the different places. So in many different places, you could get it either at a pharmacy or a mass immunization or clinic. So we specified that. The age requirement as it changed, the links to register. So these links are direct to the registration. They don't take you to just the government website. You can directly book your vaccine from these links. And then just general comments. And as I demonstrated to you, you'll see why these comments are important. So just to go through it, we have Toronto and then all the postal codes, the Toronto pop-ups, York, Peel General, Peel pop-ups, Halton, and Durham. And at the beginning of the pandemic, all of these had different pop-ups and all of these had different hotspots. But as I said, we simplified it as vaccinations became much more widespread. And also we started including information like first dose and second dose, especially that now second doses have become much more widespread too. So yeah, right now I'll give you an example. I want to go through a few examples and show you how this could be used to like best way. So let's say you're in a Toronto auto, for example, and you can just come here and you'll see that the age requirement is 12 for both first and second doses. So if I press, for example, here, I want to get my vaccine at a clinic. So I know I can get it. I can book my vaccine either through the provincial system or through a clinic. Just click here. Okay, so this would take me directly to all the clinics. It tells you that there are 23 vaccination sites that you could choose from. And you could choose this according to where you live, and you would directly just book online. And through here, you would just be able to directly book either your first dose or your second dose. So as you can see, like this is a direct link to where you can register. You don't have to go through any other processes or figure out whether you're eligible or not. And then another example is with the Peel pop-ups. Here, so what we did here with different pop-ups, they have different requirements, and that's why we don't have the specific requirements in here. But we did make sure to make that clear when you're looking at the vaccination sheet. So this directly takes you to the different pop-ups that exist, and it just tells you whether you're a youth or family member. And also, not all of them do this, but a lot of them do. But some of them do have what vaccine you can take. So this one tells you specifically Pfizer. Here it tells you the age requirement. This one, it says Moderna. So this is also extremely useful. And then you would just be able to
jump in. Just to jump in, Ahad, I think you have to stop and reshare your screen. I think your screen's black for some people. So sorry about that.
No worries. Okay.
So far, great presentation though.
Thank you. Can everyone see that?
Yep, it works for me. I think that should be good.
Okay, perfect. So yeah, with the I'm not sure where I lost you guys, but with the Peel pop-up, you can just directly click here and it will take you to all the different pop-ups. And then with the last example is if you're a Halton student, you would go straight here, you would register your appointment. So wait, I do want to make a point that with different, not all of them have 12 plus first and second doses. Like for example, for York, you have to be 18 for a second dose. But if you go up, the province does say 12 plus, and most of them do say, no, actually the province says you have to be 18 plus, but for Toronto, it's 12 plus. So when somebody gets the news that Toronto says 12 plus and then the province says 18 plus, they would get really confused. And that just shows you another reason why this vaccination sheet has made things much clearer and just easier for people. So yeah, if you're a Halton student and you're going to school, you would think that you wouldn't be able to get your second dose. So here it says 18 plus, you would register. And on the Halton website, it says that if you're a student, you wouldn't be able, but if you dig deeper into it, it says that if you're going back to, if you're returning to school, you're able to book your vaccine, but if you're not, then you wouldn't be able to do that. So another reason why this sheet is really good is because we do add these comments here for people to know that there are different ways to get it. So just as if one stream says you can't and other streams say you can, this has it all. It has all the answers right here. And then, yeah, and then we just would also list the different identification things that you need to take and different resources to follow on Twitter, on Facebook to find pop-up dates, because these would just come up out of nowhere. And yeah, that's mostly it. And I'm happy to take questions if anybody has any.
Yeah, so there were some questions that were sent to me. And so I guess we'll try and answer a couple. The first one is, can I book on behalf of someone else?
Yes, you absolutely can book on behalf of someone else, and that's actually very highly encouraged, especially if you're booking for somebody that's 12 and older or somebody that's just a senior. We highly encourage that you do that.
And when I book, do I have to indicate whether I'm coming for my first or second dose?
Yes, that makes a difference just because the different age requirements are for different doses. So when you're booking, it will ask you, is it for your first or your second?
Okay. And there's 4 different vaccines that are approved in the country. How long do I have to wait in between doses of each? Are they different?
Yeah, so it is different for each vaccine. Right now, Pfizer, Moderna, and AstraZeneca are all being, and Johnson & Johnson is approved, but they aren't using that yet. But what we did is at the top of the vaccination sheet, we added the different intervals that you have to wait. So for Pfizer, you have to wait 21 to 28 days. For Moderna, you have to wait 28 days. And for AstraZeneca, you have to wait 4 to 8 weeks. So yeah, I tried to update this as soon as the information was allowed, because, you know, AstraZeneca just recently got allowed for 8 weeks.
Mm-hmm. And what groups are not eligible currently? Or are there any groups that aren't eligible right now?
Yeah, so provincially it's 18 plus. Everybody, if you're 18 plus, you're allowed to register for your second dose, as long as you've waited at least 28 days. But with different municipalities, it's 12 plus for the second dose. So you would have to really go through the sheet and just check your area and make sure that you are eligible in the place you live.
And what form of information or identification do you need when you're going to either book your dose or when you're going to a pop-up?
Yeah, you just need some sort of identification card. It doesn't need to be your health card. You just need to be able to prove that this appointment is for the person that's showing up.
Okay. And I guess this is the last question. What about kids aged 12 and under?
Yeah, that still hasn't been approved yet. I think they'll be getting to that after they're done with the kids that are 12 and 17, because I know they want to make sure that 12 to 17 are fully vaccinated before the school year begins.
Right.
But there hasn't been any legislation out yet in terms of people that are 12 and under.
Super. So I think that was the last question. That was really great, Ahid, and I believe we shared the link in the chat to the vaccine cheat sheet.
Yeah, I agree. That was fantastic. And so the link is in the chat. We did have a comment about Waterloo, and so we can add that for the next update. It goes out, I guess, I don't think we intend it to be weekly, but we tend to send around 1 or 2 emails on COVID every week. And so that'll obviously be included in the next update. Moving forward, as we said at the start, we're going to do an interactive poll section. And so Ahid's going to lead us through that, and I'm going to run kind of the stuff behind the scenes here. So I'll turn it back over to Ahid. And can you see? I guess it's not going to do. Let's do one question at a time if we can. I didn't realize that it was going to launch them all at the same time. But
Okay, so do you have a vaccine policy? Yes, no, or in the process of drafting one? Andrew, do you want me to go through all of them?
yeah, actually, you might as well. We've got them all up there.
Yeah.
We'll give some people some time to answer, and then we can kind of review them all together. Great idea.
Yeah. What promotion tools have you used? So we just want to get to know how much you guys have been sharing this with your people and just how you've been doing it. So was it the RESCON cheat sheet, safety talks, posters and flyers, other resources, including government resources from MOH, MLTSD, and IHSA or other? Are you monitoring or collecting vaccination information from office workers? Are you planning on monitoring or collecting vaccination information from office workers? And then are you collecting that information from on-site workers? And if not, are you planning on collecting that information? And then question 7 for builders, are you working with your sub-trades to promote vaccination to their workers? And then for the sub-trades, are you working with your builder to promote vaccination for your workers? And then 8, are you using incentives to promote vaccinations? So we spoke about these earlier, whether it's time off, whether it's a gift card or whatever. And then if you answer yes, click all the incentives that apply. So are you giving sick days, decode the WSIB sick days, assistance in booking appointments, other financial incentives, or other non-financial incentives? And then last, would you participate and promote an anonymous industry-wide survey through the association promoting this event?
Great, and thank you for reading those out. So we've got about 26% of the people that have responded. We'll give it a couple more minutes here. If you're having any issues or anything, use the chat or the questions and answers. And now we're up about 30%, so we're starting to get our numbers in.
Yeah, and if you're having trouble submitting your response, it's because you haven't filled out all the questions. So you can't proceed until you've filled out all questions from 1 to 10.
Perfect. And as background, I think we're looking to do more as an industry. And so, I mean, all the questions are important, but we are really looking for an answer on question 10, right? So we'll give another minute or 2. I guess non-RESCON staff panelists are also allowed to answer. So go ahead. So Sarah, did you try Amina's tip just to make sure that they're all filled out? Hopefully that solves it, but thank you for letting us know. Okay, we just hit 50%, so we'll give 30 more seconds, and then Ahed might quickly go through the responses for us. Okay, just counting it down. You're gonna hit send. Give you the last couple seconds here. Okay, so can you see that Ahed?
Yeah, I can see
Let
that.
me know if you need me doing scrolling or anything.
Okay, perfect. So do you have a vaccine policy? No. 62% said no, 14 said yes, and in the process of drafting one is 24 people. Yeah, I think it's good to look into your vaccine policies, especially with people that are eventually going to be coming back to the office and there's going to be a lot of questions. Andrew, do you want to add something to that? No, okay. So what promotion tools have you used? The RESCON cheat sheet 27, safety talk 70, posters and flyers, and then other resources including government 59. Yeah, this all looks good. It looks good. It's good to know that you guys are using promotion tools and speaking to your people. I would highly suggest using the cheat sheet more. It's very, very useful. We've put a lot of effort into it, and we will be adding Waterloo for sure. Are you monitoring or collecting your information? So 59 said no and 41 said yes. I think it's going to be important at some point to know who's vaccinated and who's not, especially with the take-up increasing now, and also to kind of understand how your promotional efforts have been working. It's just good to understand. Are you planning on monitoring? So 59 said yes and 41 said no, which is approximately like number 3. Are you monitoring or collecting information on on-site workers? 76% said no and 24 said yes. It's a big number that are not, but I think it wouldn't be too difficult to, well, we have to get into the legals of it, obviously, like Mike Sherrod did, but with no, I think it's going to be good to know. Are you planning? 54 said yes and 46 said no and 54 said yes. So that's good. That means that all those that haven't yet begun are going to start soon. So are you working with are the builders working with subtrades, and are subtrades working with builders? 68% said no and 32 said yes. I think that's these are the key people to be working with because they're directly connected to those on site. So for them to work together and collaborate would be the best answer. So are you using any incentives to promote? 43 said yes and 57 said no. And for the which incentives are people mostly using, it looks like people are mostly sticking to their COVID sick days. 51% said they're using their COVID sick days. 32 said non-financial incentives, 11 said financial incentives, and 5% is assistance with booking. And then would you participate and promote an anonymous industry-wide survey? 70% said yes and 30% said no. Hopefully we can get something out soon, and for all the 70%, thank you.
Yeah, and thank you for running us through that. The one that certainly jumped out at me is we certainly need to now promote more cooperation between builders and subtrades. And so looks like it's time for another ORCA meeting, maybe another CEC meeting with our industry partners, and maybe a board of directors meeting on our end. But we all have to be on the same page here. So we appreciate the answers. We appreciate the honesty. And thank you, Ahed. We really do appreciate your efforts when it came to COVID. I guess when we were interviewing you, I'm not sure COVID even was part of the interview. And so you've been able to show a lot of flexibility and pick up on an important issue. So thank you there. With that, I'm going to introduce some people who are going to sit on our panel. And so I'm just going to bring them to the front here. I'm going to ask JS to start sharing his screen. There we go. Perfect. I'm going to spotlight him if I can. Just one second. Add spotlight. Perfect. Okay. And so we haven't done a panel for a while, but we thought it was appropriate because we kind of want to have a very practical approach to today's webinar. And so what we'll do is we'll kick it off just with introductions. And so I think everybody knows who I am. I'm going to have the honor of moderating this panel. But what we'll do is we'll start with quick introductions for everybody, and I'll ask JS to introduce himself.
Thanks, Andrew. Happy to be here. My name is JS Bedell. I'm the Vice President of Integrated Delivery at the WSIB and responsible for the administration of the new COVID-19 Worker Income Protection program.
Perfect. And then we'll go to Dean.
Dean Dunn, I'm Vice President of Stakeholder and Public Relations for the Infrastructure Health and Safety Association, or IHSA as we all know it as. Part of my team, along with the marketing, is responsible for a lot of the COVID documents that have been produced over the last 16 months.
And then we'll go to Amina Dib.
Yep, my name's Amina and I'm the Manager of Government and Stakeholder Relations at RESCON.
Perfect. Okay. And so it's not necessarily a traditional panel either. We're going to kind of start with a mini presentation here. So the first theme in question really relates to COVID sick days. And so the specific question for you, JS, is, for the employers who are applying for reimbursement under the WSIB program, or I guess reimbursement program, what tips can you offer? If they need help, how do they get it? What resources are available? I think you should be able to share your screen, but we'll turn it over to you.
Perfect. So I will share my screen. I just popped in the chat here the address for the ministry's website that gives you all the information on the program, and it's from there where you actually apply for specific reimbursement with the WSIB. So if you give me a moment, I'll jump right into the website here. And should be able to see. Can you see the website screen I'm showing? Right.
We can.
Yes.
All right. So this is the main website that the ministry's created for this particular program. There's a lot of great information that explains exactly what is the eligibility criteria. So what exactly can a worker take a particular COVID-related sick day? Again, to remind everyone, it is for up to 3 days and up to $200 per day. So you can see here, it's a fairly wide-ranging list of reasons why the employee can obtain a paid sick day up to that $200 per day. So fairly exhaustive list, from getting the vaccine to align with the earlier conversation, or even if you're having symptoms from the vaccine after you get maybe your second dose, the employee would be eligible to take up to 3 sick days that are paid and reimbursed through this particular program. You can see here at the bottom of this particular screen, the ministry's created a contact center, this 1-800 number, where those the individuals that are manning that particular call center will be able to answer any questions about program eligibility. It's commonly used for employees that don't have access to paid sick leave in their normal operation. But there are circumstances where if you've exhausted, for example, all of your paid sick leave that you may have in your as part of your employment relationship, you can still be eligible for these days if you've exhausted all of those days prior to April 19th. What I'll just clarify on who is eligible for these days, we're talking about employees based on the definition under the Employment Standards Act. So independent contractors, to be clear, aren't eligible for the days, the reimbursement here. What I'll flag as well, and I'll get you down right to the application process. So here from this website, you can see a submit a claim. This will take you to a separate and distinct portal where you'll be asked for information about the employer specifically. If you have multiple work sites, there is a requirement to have applications by work site. To be clear, I don't mean individual projects. It is if you have a multi storefront or multi office operation. It's not for every individual construction work site in your particular case. Once you submit a claim, there's actually an ability to check the status of that claim. So by clicking here, you'll have a confirmation number that will give you an ability to see if there's any further information required, if it's been approved, and we're just waiting for a particular payment. Again, here you've got the information for the contact center, but there's also some specific support that you can request through this ticketing process. And through this information, you're actually able to provide, if you have a claim, you can enter it. But if you're just having a technical issue with the site, a little bit of information is collected, and then we'll get a response back to you in the next couple days to help you respond to the particular inquiry that you may have. The eligibility period, just to remind everyone, is from April 19th until September 25th of 2021. And you have 120 days after the employee has taken their leave to submit your application. Two very quick last points. There can be no duplication between a WSIB injury and illness claim and a paid sick leave claim. In a situation where those occur, a WSIB claim, injury and illness claim, will take precedence. So if the two are essentially pop up in our system, the claim under this worker income protection program will be declined, and the WSIB claim, if it proceeds, would end up being approved. The last thing that I will flag, so one of the challenges that we've heard since the site has rolled out is there is a maximum of 10 employees at a time. So you can file within one claim up to 10 employees for their particular sick day. For some larger operations, or for operations that may have accumulated a number of applications before putting them in, what we heard was some challenge in that process, a fairly laborious process. So we recently proposed and received approval from the ministry to create what we're calling a mass upload tool. It'll take about 5 weeks or so to get that up and running, but that will allow employers the ability to extract from their payroll systems the information that we're looking for, and to upload that information rather than having to manually enter all of the information. This again is for employers that may be filling, in our minds, somewhere 40 or 50 individual employees taking these sick leave benefit, and then that'll give you an opportunity to upload the information without having the manual process that currently exists. With that, the ministry is exploring that 120 days. Obviously, if you're waiting 5 weeks for this mass upload tool to be available to you, it'll be difficult. In some cases, the 120-day limitation may come into play. So the ministry is working both on broader communication to announce this tool. You're literally the second group that has found out today that we're proceeding with this mass upload tool for those larger numbers of applications. So in the next week or so, the ministry is looking to provide communication about the tool itself, but also to provide some clarity on whether they'll be able to obtain an extension to that 120-day limitation for those employers that are deciding to wait for this tool to be available before submitting their application. So Andrew, maybe I'll pause there, and then through the panel or the Q&A, I'm happy to take any questions from the group.
Yeah, absolutely. And I think that was great. And you know, it's something that certainly we've gotten a lot of questions on at RESCON. So I really appreciate you walking us through that really practical step-by-step process. So we're going to move to more of a traditional format here. I'm going to ask this next question to Dean. He can give an answer, and then we'll open it up to JS and Amina who want to jump in. Today has really, and COVID really has been about building a culture of safety on site. And so, you know, to Dean to give the first answer, how can we incorporate vaccine promotion into our efforts related to building a culture of safety?
Thanks for that, Andrew. I thought about this when we were talking, and one of the things that I came down to is basically there's two ways. And I think the first one is making sure that your employees are informed. Make sure that they have the information that they need to have in order to make that decision. We all know construction industry, and we know how the rumor mill works inside of the construction industry. And then we all recognize that there's a thing out there called Dr. Social Media. I actually have a brother that's very involved with Dr. Social Media, and he goes there all the time to solve all of his problems. And I think we got to kind of pull back on that and say, well, hang on, let's actually give them the information they need about the vaccines. What do the vaccines do? What can they do? What's the benefit of them? That's the information we need to do for that. So first we have to inform the workers. And then I think the next thing we need to do is find a way to motivate them. So me personally, I have a granddaughter that was born on February the 26th. I haven't seen her yet. Right? I'm double vaccinated. My daughter goes tomorrow for her double vaccine. My son-in-law goes for his double vaccine. All right. So in 3 weeks' time, we're going to go see them. All right. So we have to look at what motivates people. So is it the emotional motivation where they want to go see their family or their friends? Is it maybe what they want to do is they want to get vaccinated so we can get the numbers up so we can get more things open? By the looks of both Andrew's and my mop that's sitting on our heads, we really want a haircut. All right. So there's one thing there as well. Is it a sense of duty? All right. Is it something that you want to be able to say, hey, we talked earlier, if you had 3 out of 4 people that are vaccinated, one's not vaccinated, maybe we can do a sense of duty, get that 4th one vaccinated, all right, to bring them along. There's the whole help lift the restrictions. All right. The more people we have vaccinated, the fewer cases we have, the more, let's call it freedom or a sense of getting back to normalcy. All right. Wouldn't it be nice to go sit in a restaurant at some point in time without having to put a mask on to get in, to wash your hands when you get out of the vehicle, when you got into the restaurant, when you sat down, and then do the same on the reverse? It would be really nice to do that. So these are all ways of informing people and motivating people. I've asked our marketing and communication department, we have a campaign called Keep Your Promise. So I've asked them to come up with some posters or some information in regards to, keep your promise by getting vaccine, or keep your promise by doing this, or keep your promise by doing that. So look for that. We're going to bring that. And once we've got it, we'll put it on the ihsa.ca website. We'll put it underneath the COVID-19 resources. I know you've all been there. I mean, the number of people that we've had to the website tells us that, right? That people are going there and they're finding the information. So in a nutshell, those are my 2 things. One, we've got to make sure that we inform workers, we give them the right information, and they're dealing with facts, not myths, right? Get rid of Dr. Social Media. And the other one is find a way that motivates your employees. What means the best for them? Maybe it's an incentive. Okay, you get a Tim's card, whatever it is, but take a look for that and be flexible and to try and find a ways to deal with that. As Mike said, you can't really have a policy that says you must do this. All right. So if we can't do that, how else can we do it? And I think the way to do that is through motivation.
Yeah, and I'll open it up to either Amina or JS, but I like that idea of, we have a culture of safety. You know who your workers are, you know what motivates them. So, motivate your workers the way that you do with other things, and just apply COVID to it by understanding their kind of needs and motives. So I'll let Amina or JS jump in if they've got anything to add.
Yeah, I guess just echoing what Dean said, like not getting COVID was as much as like a collective effort as much as it was like an individual effort. Like there was individual responsibility to do your part. And I think getting your COVID vaccine is part of that. You're doing your part, whether it's for your fellow workers on site or your parents, or whether it's because you want to go enjoy the summer, whatever your reason may be. Employers should try and appeal to that to motivate them. And again, shameful promotion of the vaccine cheat sheet, but make it easy for your employees to get the vaccine and help them out to get it if they do need help or if they're struggling. So yeah, use the vaccine cheat sheet that AHID has worked very hard on, and make use of other IHSA resources that are available as well.
I'll kick it over to JS for the last word on this topic.
Yeah, I mean, I think this topic has, and the unfortunate circumstance that the illnesses and the disease have put on workplaces has been, I think, challenging across all different aspects. I can share from our own experience from day one through to today. Communicating clearly with our own staff have been very important. They've wanted to know what we've been doing to keep them secure. They've wanted to know what the working conditions would be like eventually once elements of our workforce would be returning. And they wanted to know that that we're there to support them through some difficult and confusing times with obviously all of our workforces having to deal with their own personal circumstances at home with families and whatnot. So we've found we've received great reception by being very open with our staff about what we know, what we're able to share in terms of what the workplace may look like in the future to ensure that they're able to make informed decisions for themselves and their families.
And then moving on to the next question. The next question really starts to deal with mental health, but I think it really picks up on that culture of safety approach. I think construction always had a good culture of safety, but I think what we've been able to do in the last 16 months, I'm so proud of the RESCON Health and Safety Committee, the CEC, all of the industry partners that I mentioned off the top. The way that we came together as an industry with COVID was simply breathtaking. I think one of them was, there's never been a time in construction's history where we've, essentially focused just on one task. So March 2020 hit, and every association, OHBA, sewer and water, roads, HCAT, ORCA, there was one person at all of those associations, and they just had one job for the first time ever, and it was related to COVID. And that dedication and focus of resources really propelled the culture of safety. And so I'm optimistic that we can take some of the progress that was made and we can apply it to other health and safety issues going forward. With that, our next theme is really on mental health. And I think everybody recognized fairly early on that one of the big impacts, it wasn't just physical health, it was mental health. And I think everybody was feeling the impacts of COVID with their mental health. I think what surprised a lot of people, and certainly surprised me, in the last 3 months, I think everybody felt COVID the whole time, but it seems like from March on, it just went to a new level, and that seems to be fairly universal across the board. And so with that, I'll ask the first question to Mina, then I'll open it up. But understanding that COVID has really hit, people's mental health hard, especially in the last couple of months, what resources are available for on-site and in-office workers? Because we do know that the government has made a number of key investments in those areas. So I'll turn it over to Amina.
Yeah, so we know that mental illness is the #1 cause of disability in Canada, and that 44% of Canadians have coped with a mental health challenge, but only 25% get the help they need. I will note that those numbers I just quoted are pre-pandemic, so they're probably even higher now. However, there are a variety of free resources available to all Ontarians, including construction workers. The first is, and I'll put this in the chat right now before I forget. The first is a helpline called Connects Ontario. And so that's toll-free and live chat services. I believe it's 24/7. The second is Bounce Back, which is a free cognitive behavioral therapy CBT program that offers guided mental health self-help supports for adults and youth 15 and older. And then the third is another cognitive behavioral therapy, which is CBT is practical short-term program which is also delivered online. And this is about like building skills and strategies to address symptoms of anxiety and or depression. And this therapy is funded by the government and delivered through an organization called Mind Beacon. And again, it's free to all Ontario residents. And let me just put that link in the chat before I move on. And then there's also services that or benefits you can access if you are covered by a unionized employer benefit fund. And so specifically, for example, Local 183 members can find free resources through Leona Cares Mental Health Resource Center, where they can find resources, take an assessment, and see what benefits are available to them. Like any benefits, I would advise you to check with your benefits providers to see what specific services you are eligible for. Asking is kind of the first step. If you don't ask, then you won't know what's available to you. I will add that I think there is an immense benefit in informing health and safety reps what services are also available. So if someone does come to them and ask, they're available to share that information with them. I think that's a good first step. And I will also add in this plug that I do think that basic mental health first aid training is also a really good first aid step in mitigating some issues that could occur on site or in the office.
I appreciate that, Amina. So I'll open it up. Any questions or comments by either Dean or JS?
I might add just from our side, beyond communicating with our staff, we've also made available to them a number of different programs. We have our own peer support program that existed prior to COVID-19, but I'll say that its utilization has increased exponentially. So this is where we've got a group of staff that are trained to support their peers and colleagues dealing with a number of different situations, and COVID-19 has been one of the reasons where we've seen some growth in the uptake in that program. We also have, as many employers do, an employee and family assistance program. So we make that available as well to support our staff through a variety of different support programs and support structures to help them if they are themselves dealing with some challenges with the particular circumstance they find themselves in. And again, just finally, we've put together a number of different resources to remind staff, quite frankly, of the separation of work and home, which gets that much harder in the current environment where a good portion of our staff are working in non-traditional environments. So we're making sure that you've got a comfortable workspace and able to take the appropriate time to create that separation. We think has been important to make sure that our staff have had the right environment to support them through the challenges that I think everyone's facing.
And I'll give you the last word on this, Dean.
Yeah, so I want to support what Amina said in regards to mental health first aid. We've made it mandatory that all of our supervisory staff, from the president, CEO, all the way down to supervisors themselves, have taken that program as well. We also thought it'd be a good idea that everybody on our joint health and safety committee would take that program. So in thinking about mental health, IHSA has just hired a mental health specialist who is now on staff. This mental health specialist will be helping various industry stakeholders in helping them, look at and discuss and maybe loan some assistance on what they could do to improve their mental health. So if anybody is looking for some assistance, please feel free to reach out to IHSA and to myself, and we'd be more than glad to introduce you to Kathy Martin and see what she can do to assist you.
Fantastic. And so we're going to actually start to wrap up the panel here. My favorite part of any panel is, if and when they stick it to the panelists and they say, give us one final thought. And so I'm going to do that right now. It doesn't necessarily have to be on a topic related to the panel, but at least keep it related to COVID. You know, if there's one takeaway you want to leave with the people watching today, what is it? And I guess I'll start with Amina.
Sure. I mean, I would just say go get your vaccine if you haven't, whether that's your first or your second dose. I think that's, again, our best line of defense. But also don't let your guard down once you've gotten those 2 doses, because I don't think we're out of the woods yet.
Perfect. And then I'll go JS.
Yeah, I mean, I saw the numbers in the survey just before I joined around the utilization of COVID sick days by your group at somewhere just over 50%, which I think is great. I'd encourage employers that haven't looked into it yet to go to the website that I popped in the chat and to get the information. It's something obviously we're trying to encourage workers to have access to those days when needed. And obviously wanted to make sure that employers could be reimbursed for that particular benefit to workers. So if you haven't looked at it yet, I encourage you to do so and to use the resources if you have any questions, either through the contact center or by submitting a question through to our group if you're having issues with an application.
And we'll give the final thought to Dean.
Back and clean up again, I see. So for me, stay the course. We're close. We're not there yet. We're not out of the woods, but from where we're sitting, we can see the light at the end of the tunnel. So keep your policies and procedures in place. Wear your mask, maintain 6 feet of distance, wear eye protection when you can't maintain the distance. Keep in mind that public health looks after the public. Ministry of Labor, Training and Skills Development, they're looking after the workplaces. So even though the restrictions for public health will be coming down, it doesn't mean that they're going to change when it comes to the workplace. So stay the course, don't give up, and let's see this to the end.
Perfect. And I just want to thank all the panelists today. As we always do, whenever we do a webinar, we make a donation to a charity in lieu of, I guess, speaker gifts or different things like that, recognition. I forgot to mention it off the top. I'm not sure it's appropriate, so we'll go through the conflicts of interest, but because Ron's retiring, if we're allowed to, we'll see if we can make a donation to a charity of his choice, just in recognition of his work over the last 16 months, if we're allowed to. I don't want to get in any trouble here. But as I start the closing remarks, I just want to say thank you to the 3 people on the panel. And I guess the first part of the closing remarks is just, a thank you to everybody today who participated, but also everyone who took the time to speak and join us. As everybody's heard, health and safety is a team effort. And so the way I look at it, whether you want to call it a stool or something else, we've got 3 pillars. We've got employers, we've got the government, and I say that broadly, MLTSD, IHSA, WSIB, and then we've got the workers and we've got the unions. And as we all know, stools don't work very well, once you remove one of the legs. And so it really takes efforts on all 3. Thank you again to Mike, who's joined us again. And obviously we said thank you to Ron and the minister. Also, thank you to staff, Ahed, Amina, but also Rose, who does a lot of work behind the scenes. And thank you to the different partners who contributed and helped plan this. So I think it was OHBA. Let me pull up the list again. I don't want to forget it. It was OHBA, ORBA, OGCA, HCAT, and ORCA. As a construction industry, there's 7 sectors, and when we start to do things together, it really starts to go well. So getting into it, this is a global pandemic, and the focus still needs to be on getting people vaccinated in Ontario. But I think we need to realize that the vaccination rate globally is still fairly low. And as we know, they're literally changing how they classify the variants. And I think that's because we expect a lot more to come. And so what's happened is our response, and we've needed to change our response with each wave. I'm optimistic that we're not going to have any more waves, but I'm also realistic to understand that right now, kids under the age of 12 are not getting vaccinated for obvious reasons, but they are going to go back to school, it sounds like, in the fall. And so that's going to be interesting. We also have a flu season in the fall. which based on last year's flu season was also interesting. So we're certainly not out of the woods yet, but we have done a lot of good work. We have been able to really reinforce and expand our culture of safety. And I'm really excited. I think most people who know me, I've never been one to reinvent the wheel. And so as we continue to do good work on COVID, how do we take what we've done on COVID and apply it to other issues? I think today you heard us say, how do we apply it and recognize the need, for a specific approach to mental health? I also would expand that into DEI and some other areas. I think we have a model that works. Construction has done very well in COVID, all things, considered, and looking at it relative to other industries. And so we need to take what we've done well and expand it in other areas. Looking forward, RESCON is going to host a mental health event in the fall, so watch for that. We are going to launch this industry survey in partnership with the associations that I've named, as well as the CEC, as long as the CEC agrees to participate, which I assume they will. And then that being said, final note, stay safe, have a great Canada Day. And if you do one thing, get vaccinated, promote other people getting vaccinated. And the only thing better than one dose is 2 doses. So with that, unless anybody else wants to say any final thoughts, we'll wrap it up. But thank you to all the speakers and all the participants.
Thanks, Andrew.
Thanks, everybody.